It's 4 o'clock, so we'll begin. Just to tell you what we're doing is that the Finance Committee has 20 days to review the tentative budget that was presented and come up with its recommendation to the full board. So the first night was the budget officer's night, which was Monday. We went through the whole budget, and we basically we briefly just went over where there were changes and that were made by him from the departmental request. So what these meetings have are two purposes. One is it may have been we've lost sight of what the departments do, not necessarily us, but the taxpaying public. So this was an evening where you can share with the public what it is your department really does. All right. And the second thing is, if there are changes or drastic changes that you want to give us your point of view, then we're here to listen. All right. So having said that, the floor is yours. So you can start off, Kim, by describing your department for the press, basically, hopefully.
For the press? Well, I could give her our description. Everybody here got our description of our department. I'll give you the description. I imagine you've all read our description that we submitted with our budget. It's a part of your backup documentation, that big book you got. The big one? The big one. Do you have any questions? I do want to point out that on the documentation that we gave to you, it did say that our base state aid grant was $406,000, and it's now $500,000, our base grant. We never
That's
used
the cap of what we can go up to, huh?
We
Generally don't have it.
never hit our cap usually, because if we did, the more we use of their money, the more we got to use of your money for the maintenance of effort. But I'm going to give this then.
So what's that equate? Does that equate to anything in the budget?
No, not really, because actually we were even under the $406,000 cap when I put the budget together, so it really doesn't make a difference that we're able to go up to $500,000 because we were still under our $400,000.
Is there anything that we can drive? I mean, now that you just brought that, is there anything we can drive towards that? Is there direct costs that we can drive towards that 500 that we're not currently recapturing?
No, all the costs that we can currently apply towards that state aid line are being applied towards it. You would have to appropriate more into our budget for us to get more of that. We would have to add positions or
More of what? I mean, more of a program or more in benefits?
more
The cost
more
account
enhancements
more
to
money.
the programs that we have to provide under that state aid funding. All of the appropriations that are claimable under that state aid funding are figured in and calculated into the revenue that I put into that line already. So there's nothing more within our current budget as it's been submitted that can be requested from that state aid funding, even though we have a $500,000 cap.
No.
The way you get to the $500,000 cap is you give us more money to increase our programs.
No, I was wondering in terms of our benefits included in that.
No,
So you're not
fringe benefits aren't funded.
aren't fundable. Okay.
The state is pulling back on more what they are funding. They're clarifying specifically what's fundable by state aid and what's not. In fact, in the past, Deb had one time they wanted her to submit for some TB testing for employees, and she had to point out it's not fundable, because it's not. I mean, they would have picked it up later.
Okay, so let's go through, basically there's
So
always,
basically, you have the basic public health core programs, which is your STD, your CD, your rabies, your child car seat program, the core programs, chronic disease, communicable disease, emergency preparedness is now considered a core program in public health. And that is funded through the state aid, which we just discussed. Then we have the early intervention program, which Deb has here in this description for you, how much that costs. The county cost is approximately $54,000 for the early intervention program, which is special needs children birth to 3 years of age. And then we have the 3 to 5 program for children with special needs that we provide services to, which is the bulk of the county's cost. 92% is what Deb has of the 2014 budget for the public health department. 92% is the cost providing 3 to 5 services.
Huge.
It is, and it's the program that we really have the least control over as far as the cost. So it's decided by at the school district level, and we get to just pay the tab, basically.
You have to administer what they tell you.
Right.
In your packet, Deb also put together, she outlined those costs on the spreadsheet. That's in your backup document in that big thick book. Any questions? There was some corrections that we put through, I understand, to the tentative budget for us.
There were some that I believe Sean presented on,
You'll see that, like I said, if you're looking at the budget, it appears that there's a large increase in full-time salaries, but that's not the case based on the corrections.
Yeah, it looks like there's 85,000 or something.
Well,
that's
yeah, what
not-
happened was I submitted the breakdown of the salaries that are partially grant funded, and Sean had input those. And we printed off our budget submission, and it was fine, and somewhere between our submitting the budget and Sean getting to work on the
There was a
program.
issue, because I changed salaries 3 times and
Yeah.
still reverted back to what the
It kept
original
kicking
was.
to the wrong.
And those particular lines, it allocated the entire salary for those people.
Yes.
Some of those already allocated towards grants.
So with this, we're square.
Yes.
Well, then we have a resolution coming forward though too, with a grant adjustment for EI. Right, Deb?
Additional.
There's an extra adjustment because the EI grant from the state, his admin grant, they're decreasing it again this year due to the fact that the state has taken over the program supposedly. Supposedly.
Is that why the cost is going down on the tuition?
Well,
Yeah, they're taking
yeah.
away the admin because they think they're doing the admin, but actually they're costing us a lot of extra admin because you can't track what they're doing. It's a nightmare, a physical nightmare that we've been dealing with.
There's no really new changes to our budget. Everything is pretty much status quo, except for the EI program, which transitioned over to this state takeover in April of this year. When we budgeted last year, we weren't sure if and when that takeover was going to happen, so we had to budget like the program was going to continue as it always had. But it did end up transitioning over in April, so what's happening now is rather than us paying providers up front, we're getting hit for the cost from the state on the back end of it. So we're seeing the cost supposedly after insurance and Medicaid have been tapped, but there's a major problem going on with that. Providers are being hugely delayed in payments. They're not wanting to work in the program because of that issue. So that whole way of how it's being handled right now may even change going forward. So I projected the best I could based on what we're doing right now. We reduced it for next year based on the fact that we're getting hit on the back end of things after Medicaid and insurance has tapped in. And so that's why you're seeing a reduction in cost. Not that the cost of the program overall has reduced, it's just that the way that we're seeing expenses is reduced. Because you'll also notice that the Medicaid line in our budget is gone down to nothing.
You have a question?
Dominic?
yeah. Tell me.
So from what you submitted as your budget and to what Sean presented to us, are there any major, in your mind, that you can't live without, if any?
The whole thing, the whole budget.
Well, I
If
think
you wanted me to run the department, I need the budget.
No, I'm saying, compared to what Sean did, and.
No, what Sean did, I think you would do, make an adjustment to 3 to 5.
small adjustment.
And 3 to 5, we're responsible for those bills, we pay
So-
those bills. It's
That's what I'm
an
trying to get at,
estimate.
was there anything that Sean did to this?
If we need it, we'll come back and see it.
Right, so
you
you're
know?
good.
So we're good.
He made a small adjustment that made like a $9,700 net cost change, and I think,
A lot of times, he might make a small adjustment that means nothing, I don't want to say means nothing to us, that we might not understand, but means the world to your department.
Right.
yeah.
That's why I'm asking, it might be a computer, it might be a,
Yeah, no.
whatever,
I
everything's
mean,
good?
and that line in 3 to 5, he could possibly be correct, that maybe we won't need that.
And if we do, we'll come back.
Okay.
It's all enrollment driven.
Right.
Exactly.
We do our best to keep itinerant services going when appropriate for the children versus center. Seems to be
It
more
seems like the biggest, and it's actually not a cost increase, it's a revenue decrease. So I guess the biggest effect on your budget is really less revenues?
Well, there's less appropriations and less revenues because of the EI.
because of EI you're talking now.
Well, what we used to have to do before is we used to have to pay the providers up front, and then we used to have to seek reimbursement from third-party insurance, Medicaid, and then finally the state. And they've basically taken us out of the loop of that. Providers are submitting their claims directly to the state is forwarding those on to insurance and Medicaid. And supposedly, after those payers pay the provider, we get hit with the balance in an escrow account. So that's why you're seeing less expense, probably like a quarter of what we used to incur on the expense side, but because of
Up
that,
front.
we're not seeking the Medicaid and insurance revenue anymore, because that's not our place to do that.
But at the same token, tracking whether what they're charging us is
It's
a
proper,
nightmare.
yeah.
Yeah.
It's
And
problematic.
And we've always had a really good, Deb's always been, the staff's always been good at tracking what's billable, what's not billable, billing it, seeking reimbursement, and now,
The accountability as far as our part has kind of gone out the window a little bit right now. The state has us using 3 separate billing systems for this one program. They started out with the kids program, they transitioned to the NICE program, but we were still also using kids because some kids had been in that program. And now they're onto this EI billing website, and they've just brought on their full-time state fiscal agent, who may at some point even develop another billing system. So we've got like 3 billing systems going that we're trying to track what needs to be happening as far as the state pursuing Medicaid and insurance, so that what's hitting us in the escrow account is correct. We're having a hard time tracking through those systems right now, but hopefully that will improve.
Sounds like you're making it easy for you.
Yeah. Well, they've said that it's less administration for us now, which is why they're reducing our administration grant for the program.
another thing I just want to mention is if you're Suave and you've been looking at our budget where it currently is today, and we're 3/4 through the year, it's only reflecting half a year payment for the 3 to 5 program, right, Deb?
Yeah, the expenses that you're seeing currently only reflect through June. Our July, August vouchers from our providers are kind of on hold because the state hasn't certified rates, so we haven't paid them yet. So don't
Think
get
it's money in the
confused
bank.
thinking it's up to date through September expenses, because we're not reflected in there yet.
We'll start spending the money after.
The center bases will start billing
Yeah,
once
yeah,
they
if you're
get those
looking
rates.
at, if you're looking at where we're at right now, and we're trying to project, can we take more out of their budget? I actually projected with the vouchers that we're holding, and we're probably running right about 3% under budget when I add those in. So we're kind of right on track in 3 to 5.
Any more questions?
I mean, I inputted all of those as of 9:30 and it doesn't do me any good.
Well, it is as of, but it ain't the
It is
true
as of
thing.
9:30, but it's not paid services through 9:30. It's payments that have.
Somehow or another, I have a feeling that-
Payments occurred.
Somehow I have a feeling you directed that comment at me.
Well, I know you
No,
watch
not
it.
at
I know you watch it.
All right, anyone got any questions of these two ladies?
Thank you, excellent.
Thank you.
Thank you very much.
John, thank you.
Thank you. You know, they chase guy over here.
Okay, Brenda, you want to move up front there where we can, because you speak so softly, I have a hard time. I'm the furthest one away.
I gave everybody the overview of the three departments that I oversee. Do you want me to go over that or just, what do you want to do?
Well, you're more of a merged department, so you might as well, re-explain the groups that you do have.
Basically just go over the handout that I gave by department. Okay. As Supervisor Stagliano said, we do oversee a merged department. We oversee the Youth Bureau, Alternatives to Incarceration and Veteran Services. We've been working like that since 2011. The Youth Division, I'll talk about that first. We seek funding through the State Office of the Office of Children and Family Services, and we seek that funding to distribute to agencies and municipalities in the county for youth programming. We work with a 14-member youth advisory board to work through and see how we're going to allocate those funds. It's not always easy because there's not a whole lot to work with, so we look for areas where we can pretty much get the most bang for our buck, where we can serve the most number of youth. The Youth Division is responsible for monitoring and evaluating those funded programs and making sure the support services are being offered and the goals are being met, that the state aid is expended and appropriated by we act as a liaison between the county, the state, the funded municipalities, and the agencies. We offer technical assistance to each of the municipalities and agencies that we fund. We help them through the application process, the claiming process, and the whole slew of state paperwork that's involved with claiming this money. We partner with service providers within the county and focus on issues such as youth violence and gang prevention, leadership development, community service learning, family intervention, after-school programming, life skills education, juvenile justice issues, teen pregnancy and STD prevention, and family mediation. There's evidence that strength-based positive youth development, as it applies to juvenile justice, has a strong impact on reducing or preventing juvenile crime and its reoccurrence. We need to consider the astronomical cost of placing youth in mandated non-secure detention versus the small cost of the preventative services that we give out. For example, it costs approximately $350 a day to place one child in a non-secure facility. So that's a 30-day stay in a non-secure facility can cost over $10,000 for that month, and you're talking over $126,000 for a year for one child to be in a non-secure facility. If you talk about secure facilities, it's a whole lot more. So the little bit of funding that we try to give out and distribute for youth programs in our county will save on that detention side. So the average cost of a positive youth development program funded through our division averages to only about a few $100s per year and prepares several youth for graduation, jobs, and civic responsibilities. The elimination of prevention and intervention services increases the number of youth entering the court system, foster care, and needing expensive crisis services. Unfortunately, this is at the expense of local and state government, and ultimately goes on to the burden of the taxpayers when we have to place these children. So no matter how small our little youth programs seem, they're very important to our community. Since 2009, we've partnered with the National Safety Council, and we still hold the Alive at 25 Young Driver Education Program that's geared towards youth between the ages of 16 and 25. They get a traffic violation, they get ticketed, they go to court, the judges work with us, they order them to attend our class, and they work out a reduction with the youth and their parents, of course, who are hoping to get a reduction in their ticket. So it kind of holds the kids responsible for something, rather than mom and dad saying, hey, look, you know, I want my insurance to go up. Send them to the class, hopefully they'll learn something, rather than just paying off their fine and that's it. So we're educating the kids in that aspect. We also hold the Values Improvement Home Study Program. It's a home study version of the classroom training, and it's geared towards the transient population, people passing through our county. They get a speeding ticket on the thruway and trying to get into the report. Well, they cry, I can't come back for the class. Well, okay, we've got a home study version. Send us the fee, we'll mail you the book, complete it, we'll let the court know you're done. You'll get your reduction. So we'll reach out to that population. Upcoming, I'm planning to attend some trainings with a focus on the problems of childhood obesity and cybercrimes. These are like the latest big topics for youth. And hopefully I can bring back some knowledge and skills for our youth programs here in the county and get some programs working for those topics as well. As far as the youth budget, I requested to reinstate the funding for the outreach programs. That's the funding that was taken away for 2013. That was zeroed out. But with the topic of childhood obesity and the importance of exercise, and you know, I want to try to reinstate some of that funding to offer out to some of those programs like the youth soccer organizations, the little leagues, youth football. The expenses, the registration fees for these types of programs, of course, are increasing every year. Parents just can't afford to pay the fees, so this outreach money will allow these programs to scholarship some of these kids to the parents who can't afford to pay it. It's like scholarship money so these kids can attend those programs. And of course, it goes for purchasing of the equipment and stuff involved. So, other than that request on the youth side, all the other lines are pretty much the same.
Okay, let me start. I know your predecessor got a grant once, I think through Senator Farley or whoever. You know, I mean, and I don't think that we ever got the grant after that, but you know, I mean, we would budget that money, and I can't remember which one it is. It's either the I think it's the special program revenue. I think.
Yeah, there's.
You know what I mean?
I applied for some grant money for this year as well through Santa Barbara's office. I haven't gotten any answer on that funding. It was between a $2,500 and $4,000 grant that I applied for to apply for some youth programming. Like I said, I haven't heard anything back from that yet.
So I mean, it's usually been difficult that you don't ever receive those revenues that are budgeted, and our appropriations are based on those revenues. So I see that you reduced it from 25 to 20, which is I think that's the one.
25 to 20.
What, is that the 2660?
Special program revenue?
2616.
Okay, that is actually the line that pays the fees for Alive at 25 class and the Values Improvement Program.
Yeah, which one was the grant one? I'd have to go back and look at my. It could be the. It could be the.
3889 would be
Yeah, that's the other
the
culture and
Farley
recreation
grant.
Is that the one? Is that the one?
Mhm.
Yeah. All right. I just had just one other thing. That truck is how old?
Which truck?
The one that you're-
Service truck?
Yeah. Was that the original?
2006.
Huh?
It's 2006.
That's the original vehicle.
Mhm.
What kind of shape is it in?
It's getting a little rough. We're looking at trying to reach out for some grant money for another veterans van as well as community service vehicle. So.
All right. So that's how you're looking to replace that vehicle by looking at a grant.
That's what
And if you can't find the grant, then what happens?
Fix it. Keep fixing it.
Keep fixing it.
Okay. I got time.
There hasn't been any major knock on wood, problems with the truck as of yet.
Yeah, nobody drives it right now.
Okay, I think I had time first, then Butch, then Bill.
I was just trying to understand what Dominic was saying. It sounds like you were saying we budgeted revenues, but weren't really getting the money each year.
I think we got it 1 year because I think we got the grant, and then I think Jennifer kept appropriating that same amount of money. And we used to have that discussion, her and I.
So we haven't been getting it?
And I can't remember which one it was. And I think Sean had just, I
Lee, if you go back and look at prior year, prior to 12, that's where she would always try to budget or should I say, pork barrel money through the state.
yeah.
Like I said, a couple of years they did get it, and they used that money for the Youth Day event, but I believe she continued that after, and there was a year or two she did not get it.
Yeah, well, you said that was what, 3828?
3889, other state aids, really.
So if we didn't get it, if we didn't budget for it, and we did get it, it would be an unanticipated revenue.
Correct.
So, kind of to the, not to bring up a sore subject, but with the audit that we had, and making real budgets, shouldn't we be not expecting it if it's something that we know we don't necessarily can, how do I say it? If we're not positive we're getting it, shouldn't you not budget it as a revenue and then?
Like I said, if it's a case like here, she's only has 5,000 budgeted in that line,
Right.
hoping to get some type of legislative grant through the state. Like in the past, it was as high as 25,000.
Yeah,
Like I said, when you budget any revenues in the budget, it's a guesstimate. For like I said, departments base it on potential enrollment or other issues. No revenue is absolutely guaranteed
Right.
to the penny. So.
But if the pattern's showing that you're not
Right.
getting it,
Right.
if the pattern's showing you're getting something, then go ahead and guesstimate. But if your
Right.
pattern's, what I was hearing was a pattern was showing we're getting nothing. If that's only been a pattern for a year, that's fine.
I forgot what we used the grant for, it might have been 2008 maybe, and then like in 2009, it was, we haven't gotten any since. But the amount that I remember in the past was a much larger amount than the 5,000 that's in there now. 5,000 is not a big gamble that whether you get it or you don't get it, it's not a budget breaker. You know what I mean? The 25,000 had more impact when you didn't get 25,000. You know what I mean? So, okay, Tommy?
Yep.
I got Butch and then Bill.
Yeah, the only thing I'm asking is that you asked for 2 part-time people and John put you for 1. Is that true?
For that, that's in the veterans
Yeah.
office.
Right? Okay, you're okay with that?
No.
Well, I mean, now's the time to,
Well,
I mean, we're not
I'm
gonna make-
She's
speaking
not a
of you.
veteran yet. She's not at the veteran
I need
yet.
to veterans yet.
Okay, all right, okay. Go ahead, never mind.
Okay.
I'll wait.
Anything else on?
No, I'll wait.
side?
Bill, you got anything on the?
No, mine is toward the veteran side, so if you
Okay.
want me to wait till then,
Okay.
it's a small budget.
Yeah.
That's what I'm saying, there's nothing.
Do you want me to go through the?
Yeah, but I just wanted to cover that truck, that, you know, so that we understand what the condition of that truck is, and then, you know, next
No,
year.
there is going to be a need for replacement of that truck very soon. And I'm probably looking at applying for some grant money in the coming year.
You know, because I had heard that truck hasn't had air conditioning in 3 years, and, you know, I mean, I heard this, and,
Put it in the
I'm
capital,
not worried about the air conditioning.
put it in the capital budget.
right?
Put it up in there to bond the whole thing and get everything.
When they put the capital projects together, put it in
Okay, so we're
there.
at,
Realistic.
yeah, you want to get through that, we'll go through pre-trial release, and,
Yep. The Alternatives to Incarceration Program, it encompasses 2 programs, the Court Order Community Service and the Pretrial Release Program.
Leslie's-
Leslie's still with us, yes. Thank goodness. Both ATI programs receive state aid, and they're accountable through an annual performance-based plan submitted to the Department of Criminal Justice, Office of Probation and Correctional Alternatives. We receive funding on an outcome-based formula, and we've just been approved for the next fiscal year, 2013-14. Community service program gives the option to the judge to sentence nonviolent offenders to perform unpaid community service work in lieu of incarceration. The offender is placed at a nonprofit or public agency or municipality to perform the court-ordered number of hours, and they're to complete them in a specified amount of time that the judge determines. The judge is the sole determinant of the court-ordered community service sentence. The target population served by the community service program is any offender age 16 and up. A lot of times people think it's just kids. It's not. We do have a youth population up to age 21, but we also have the adult population as well. We have community service people in their 60s doing community service work. For those that are under the age of 18, we assign them to work in accordance with Section 132 and 133 of the labor laws. We have to make sure they're not doing community service work if they're supposed to be in school, and we have to assign them to appropriate tasks for kids that are 16 and 17. As of June 30th of this year, we had 86 open cases. Since then, 17 have successfully completed, but we currently have another 16 new cases that have come in pending intake and placement. We had 10 courts, including 3 out-of-county courts, utilize the program, and we have 65 work sites in the county where we can place offenders. The worksite list includes most of the municipalities in our county. As of June 30th, there were 4,586 hours of community service work completed in our county so far this year, and 2,640 jail days saved. Now this is where the savings piece comes in. An average jail stay of $115 a day, if you calculate that out, it shows a county savings of over $300,000 so far as of the first 6 months of this year. Total savings for the end of the year ending 2012 was $639,000 just for the community service side. Pretrial release, the numbers are much more significant. Pretrial release program, Leslie interviews defendants and provides information to the judges to determine if they are appropriate candidates for non-financial release from jail. The program is based on the belief that the money bail system imposes a disadvantage to the poor. They get put in jail. If bail is posted, not everyone can afford to post the bail, so they sit there. They sit there in the jail until the court date comes, and while they're sitting there, the tax dollars are increasing at $115 a day per inmate. The main goals of the program are to help facilitate the judicial release decisions by providing the court with standardized information about the defendants in a timely manner to get them, the goal is to get them out of the jail as quickly as possible if they meet the criteria of the program. We need to identify defendants who are appropriate for the release without financial conditions. We facilitate the release of defendants who would otherwise be incarcerated for want of financial resources, reducing unnecessary incarceration and the associated costs, and relieving overcrowding in the county correctional facility. And to maximize the appearance rates of the defendants, Leslie monitors them. She makes sure that they appear at their upcoming court dates. And she also facilitates drug and or alcohol treatment, mental health services, and social services if the need is there for these people. The services of this program are provided contractually with Leslie, and she's been working with the courts for over 20 years, so she's very well experienced with that. We currently have 29 active cases that she's monitoring. As of June 30th, there were 2,403 county jail days saved at the jail stay rate of $115 per day. This shows a county savings of $276,000 as of June 30th. For pretrial, we also track New York State prison days saved because these people also could be facing prison time. At an average prison stay rate of $71 a day, this shows an additional savings. We had a savings of over 7,000 prison days. And that calculates out to be a little over $540,000 as of June 30th. Combined county and state savings, $817,000 as of June 30th. Total savings for year-end 2012 was $1.6 million for pretrial. Combined overall savings for community service and pretrial as of June 30th of this year is at $1.1 million.
Very good.
Big savings. As for the budget for 2014, I did request a small increase for Leslie based on the savings that this program shows. I requested a $1,000 increase in her
What line
salary.
item
I'm
is that?
sorry.
What line item is that?
That would be,
4438.
yeah, 4438 under pretrial. Budget officer cut that by $500, leaving it for a $500 increase.
Chair,
Yeah, that's
Yes.
ridiculous.
quick question, is that a next level or just a raise?
She's
For
contractual.
Leslie, she's contractual.
She's
Not
contractual,
civil
so
service,
there's-
she has no
So
benefits.
there's no benefits, no nothing? Okay. Thank you, thanks, Chair.
And I requested an increase in the mileage line based on the average cost of the mileage in this line. The request for 2013 had been reduced, and I'm about $1,000 short, or a little over, in that line to get through the rest of this year. Of course, it's based on the amount of traveling she has to do throughout the county, between the courts, the jail, or wherever she has to go for these people. And I do have that same problem in the community service gas line as well. These figures in my budget are like at bare bone minimum, like there's no room for moving things around here. I go on averages, I do the best I can do, I don't throw in a lot of overage. So. I'll have the ATI.
Question?
Veterans question.
Huh?
I have a veterans question when you're ready to move on.
Well, whenever you're ready, I'm trying to do two things. Are we at veterans yet?
Yeah, I'm ready if you're ready. Everybody's good with
Yeah,
ATI?
Give her a question.
First of all, I want to tell you, I think you're doing a wonderful job.
Thank you.
The transition was relatively smooth, and I think you picked right up where Jim left off. Kudos to you. The other thing I've heard a lot about is,
Dominic.
No, go ahead.
another thing I heard a lot about was Polk County, something about they're not funding their transportation now for the veterans?
Fulton County, we've had a contract agreement with them for quite some time, where if the need is there, we'll transport their veterans to the VA. They pay us $50 per veteran per trip.
So we handle all their transportation.
We don't handle all their transportation. The problem is, they rely on volunteer drivers, and they used to have 3, I believe, that they were working with. Now they're down to 1, and
That's what it was, the drivers.
it's an elderly man, just does it because he likes to do it. And now he's not going to drive through the winter, so they're going to be left without anyone to drive, and he's not so sure he's going to come back after the winter.
What I was trying to get at is there any way that we can ask Fulton County to help us out with our situation? If we're doing the transportation, or can we build it into the contractual cost of the vehicle replacement? I mean, we're not looking to make money. All we want to do is provide safe transportation.
Their van is provided through the DAV, and there's a bunch of stipulations with that, and well, it's not here, I didn't ask him to come tonight, and he can speak about that. It limits, like they have to have volunteer drivers with this program through the DAV. We've never pursued running our transportation this way because of the limitations involved, and Fulton County seeing the problem with it, with not being able to keep volunteer drivers. Like, nobody wants to do it. Nobody wants to do anything for nothing, you know? So,
Are we still at $15 or something like that?
for the Fulton County riders,
For yes.
$50.
50?
50. Okay, it's $50 per veteran round trip, or $25 if they're going one way.
You mentioned the grant earlier, and I was wondering if there could be any other outlet for you other than a grant to bring in money for a vehicle.
Not that I'm aware of. Joy and I were talking about seeking some grant money to purchase another van.
Are you seeing your rides going up,
Yeah,
Fulton
Yeah.
County?
our county,
Our county?
yeah. We're taking, more veterans are taking advantage of that van right now. It saves on gas money costs, for traveling down there.
Thank you, thanks, Chair.
Fulton County is going to show an increase. They came to us and asked if we could, up the agreement amount, because they feel they're going to need our van more, at least through the winter months. And
So they are.
maybe after.
Okay, Bill?
Yes, thank you.
Butch?
Okay, thank you, Chair. I'd like to stay on Bill's comments. Okay. Do you think that if we talk to DAV, I mean, if Dwight and yourself talk to DAV, I mean, the vehicle's gonna sit there. If it's good, if it's not good, forget it. I mean, and I go along with what Bill says, if we can up the price a little bit, you may pay for depending on how many you get, you might be able to lease a van. Who knows, pay for it over 3 years, 4 years, whatever it is. Okay, all right, that's it. I won't harp on the van, you can figure that out. You said that you're not happy with you asked for 2, you got 1.
Okay. Well, since the 2014 tentative budget came out, I brought a resolution before the Health and Human Services Committee to put Dwight back to full-time. The need is there. So we had a discussion of that Tuesday night. It was moved to the full board. So I'm hopeful that that change is going to happen there. As far as the clerk, she's still part-time. We haven't put anything forward as far as moving that back to a full-time position. So what I was seeking is another part-time position to be there on the days that she can't be there.
All right, so this had no effect by us moving Dwight full-time to the full board. If this is, it doesn't, these two doesn't, it doesn't matter.
The problem lies, even if Dwight is full-time, if a clerk isn't there to assist, to answer that phone, all of that rolls over to either me or Janine on the youth ATI side. And that's what we've been doing since 2011.
Doesn't he answer his own phone?
Dwight?
Yeah.
When he's here, but she's saying he's not here.
If he's here, or when he is here, if he's with veterans,
Gotcha.
he doesn't answer the
All
phone.
right,
And
go
that
ahead.
phone rings
Go ahead.
all day long.
All right, go ahead.
So,
Thanks, Bill.
Another question, is Dan Roth still, are we holding the position?
he's on a
How long,
5-year
how
military.
long does that go on, 5 years?
It's a 5-year leave, and I'm still waiting on a definitive answer from personnel as to exactly when we expect him back, because at this point, I don't know.
Does that get extended? I mean, or is it 5 years and that's it?
My understanding is that it's 5 years, but it's not, we have to consider his previous military leaves are part of that 5 years, is my understanding.
Yeah.
And I'm waiting on clarification from personnel on that, because I need to know when we expect to have him back.
The only reason I ask is if Dwight gets tired,
Yeah.
which I think Dwight is doing something that he sincerely enjoys,
Yeah.
but if he gets
Can he
tired,
enjoy it full-time?
are we gonna have
Yeah.
somebody that, yeah, I mean, you're working. So I guess Dan would have first refusal. And even if he couldn't do it, you
My
still have to
assumption
keep
is
the
that
position
Dan is
open.
expected back sometime in 2015. But like I said, I don't have an exact date. If it's 5 years from the date he left for this military leave, then that would be sometime in 2016.
He isn't working nothing?
He's on the base, I think, I believe
He
he's.
is on the base?
Yeah.
Yeah.
Oh, okay. I didn't know that. Okay. I see him on Facebook and I didn't. I thought he was still around.
Okay, Bill?
Thank you.
All right.
And then on the veterans, the only other thing I had was, I had to show an increase in the van driver line. And that's just to cover more traveling hours because we have more veterans riding the van and the excess travel going to Fulton County. We have 2 pickup points in Fulton County. We have 1 pickup point in Johnstown, 1 in Gloversville, but that still takes a little time each time we have to run up there twice a day. So I had to up the veterans' salary line a little bit to cover that. And I think we reduced, I requested a computer. That was left in. Dwight's going to need that. There's a new veterans system, electronic system coming in that all agencies are going to be expected to utilize. It's this big secure network. This computer is about 7 years old, I believe, and will not be compatible with this new VA system that's going to be coming in very soon over the next couple of months. I also requested an increase in the gas line because of the extra van
Okay.
travel.
Butch?
Yeah, the computer thing, I hate to keep harping on these things, but is this going through IT?
Yes.
It is going through IT, you checked with Dan and
Yes.
everything? Okay. Thank you, thank you.
Okay. Yeah, Michael?
Can we go back to ATI?
Sure.
Is Leslie capped, the salary, that position? It's $500 to the FARS.
No, there's no cap.
There's no cap. I worked with her for 10 years. You're never going to find anybody as good as her anywhere, period. And she will save you money. She lives this.
She does.
She knows more than anybody else on this subject, and that's, salary's a disgrace. That's my opinion.
Okay, Michael?
Yeah.
Want to start with veterans? Yep. Oh, and we're all done?
Oh, are we?
Did we hit the youth programs?
Yeah.
Oh, okay. Now, Bill was right. The transition was seamless. And so that's kudos to you. All right? And because as we look at those salaries, the thing is, do you do anything different than what was done before? Do you do anything less than what was done before? Okay, I just wanted you to say that.
I'm still training the new person that replaced my old position. It took me 6 years to learn what I'm trying to push on her in the last few months. So it'll take
Okay.
some time to get her up to
All right.
speed with everything. And now I'm going to have a new community service person to train as well.
Okay, thank you.
Thank you.
Thanks.